It's an absolute pleasure to be here today. My name's Erin. I'm a health outreach worker at the Corner in Dundee, and I'm here with my colleague Katie Anderson, who is a learning and development project worker with Hillcrest Futures. It's been so great for us to be here today as a young people's organisation, but also kind of hearing all about all of the other great work that's currently happening in Scotland. It's fantastic. I just realised I've not got the clicker. Here we go. So Strive is a Cora-funded partnership. It is a partnership between the Corner, which is an NHS Tayside service funded under the Dundee Health and Social Care Partnership, and it's in partnership with Hillcrest Futures, which is a third sector organisation in Dundee. So starting off with the Corner is a well-known service in Dundee. It opened its doors in 1996. If you're from Dundee or if you grew up in Dundee, you'll probably know and heard of us. We're probably best known for kind of our sexual health services initially. This can be things such as contraception, STI testing, and pregnancy testing. However, over the years, the service has progressed and developed, expanded into a much bigger service, providing a lot of what you'll see on the screen here, including things like counselling and young carer support as well. What's really great about the Corner is that this is all delivered under one roof. Young people have access to all these services. There's no need for that kind of extra referral. It's quite an easy transition through the services. A lot of young people become familiar with the staff and they know who to go to if they need that support. The building itself is actually just across the road, one of these ways, on Shore Terrace. I've just lost my bearings. And it's really accessible for young people via public transport or if they kind of stay within the city itself. The Corner operates a drop-in service, so from Monday to Friday, from 1 p.m. till 6 p.m, young people can drop in as and when needed. They don't need to make an appointment. They are greeted by our lovely admin staff at the door who hand them a small card. On this card, they check which service that they're in for, they grab a wee seat, and a member of staff comes over when they're ready and they'll be seen at that point. However, if a young person does want to make an appointment, they can do this using our online service, or also kind of ask any questions or make an appointment through our live chat function as well, which, as you can imagine, takes away those barriers of having to make that phone call or dropping in kind of face-to-face as well. The Corner also are kind of in the early stages of delivering something called In Your Corner, which is where we're gathering data around which postcodes and things that most young people are coming from, and actually in sort of the east outskirts of the city there were some young people that maybe weren't coming in, and we think that was just because of the distance and things. So In Your Corner aims to take the whole Corner service out to them, and kind of since we've been trialling that, we've already noticed a lot more people from these areas coming in and being more aware of the service, so that's been really great to see. And the Corner in general, kind of in the past sort of 30 years, is kind of one of the main services in Dundee for tackling those health inequalities for young people. So it's a fantastic service to be a part of.
So also within Strive we have Hillcrest Futures. Hillcrest Futures is a very wide and diverse organisation supporting young people and adults. Along with housing, social care and outreach support, Hillcrest Futures is one of the leading providers of substance use in Dundee. Harm reduction is a large part of our service, in which we provide bloodborne virus testing, IEP and specialist nursing support at our South Ward Road service. In August this year, we relaunched our OD Not Me campaign, which raises awareness for overdoses in Scotland and also promotes the use of naloxone. We've also been chartered to develop the first drug testing machine site in Tayside, in which progress is underway. As well as our services on offer at South Ward Road, we have a community recovery team, and they support adults affected by substance use. When it comes to young people at Hillcrest Futures, they can access the services at South Ward Road. However, the environment is not typically tailored towards this 12 to 16 age range. Therefore, it was then acknowledged that these young people needed a dedicated space in order to access support suitable for them. So therefore, we have our Baxter Park office, and this has just recently undergone a makeover. So this is now a much more welcoming environment for not only our young people, but also our staff as well. The young people that we support help design and spray paint the exterior of our building as well, which was great. And our young people can choose to access their support within this building or out within the community, whatever they prefer. So as you can see, we have 2 great services on offer here. However, there were gaps that were highlighted in which young people were having to go through a lengthy process of visiting multiple separate services in order to meet their substance use needs. This became increasingly apparent during and after the COVID period, where there was an influx of young people living within hostels and also at risk of homelessness, and many of which were using substances. So services were identifying the need to support said young people. However, at the time, there was limited support dedicated to this 16 to 21 age bracket. These young people were too old to be accessing children's services, however, were also at a vulnerable stage to be accessing adult services. So this then left a lot of young people displaced and unsure of where or if they could access non-judgmental support for their substance use. So we had the Corner, who was well established in providing wellbeing support for young people. However, they did not necessarily have the substance use focus. And then we also had Hillcrest Futures, who did have the background in substance use, but they were limited in what they could offer young people in emotional and sexual health provision. This was where Strive was developed in order to bridge this gap. Initially, Hillcrest and the Corner put in a joint bid to CORA in order to receive 5 years of funding to support young people aged 16 to 21. We were successful in gaining this funding, obviously, and a year later it was then identified a need for an even earlier intervention, so therefore we were successful in gaining more funding in order to support young people aged 12 to 15 as well. A need was also identified to support parents or family members affected by somebody else's substance use. So this bridge was designed in order to reduce a young person's journey where they could access all of their support within one place. Young people can choose where they access this support between our 2 locations, and by combining NHS and third sector, not only brings together specialist knowledge and experience from both, but also allows for better information sharing and access to a more holistic service with a smoother transition between healthcare, education and social work.
I have to stand so doing this. Sorry, let me just catch up here. So as a service, we have 3 main outcomes, which you'll see up here. As a team, we're achieving these outcomes currently through our one-to-one support sessions with young people themselves, but also we have a family worker who will carry out one-to-one support with parents or carers. And we also have links to weekly family support groups as well. And as well as naloxone training, this year our team developed our Know Your Stuff workshop, which is a workshop designed for parents and professionals to improve their knowledge around substances and have more proactive conversations around substance use with young people. And we'll touch on this a little bit later. So we're now just around 2 years into the current 5 years of funding, and during this time we've worked with just shy of 500 young people and around 10 families. Kind of just worth noting as well, our 12 to 15 service started in 2023, so we're just a little bit delayed with those numbers, but kind of all together you can see up here as well. And this has been a mix of sort of from one-to-one support, from our education sessions, but also drop-ins and discussions with young people at stalls and events as well. As you can imagine, the first year was a lot of networking. It was a lot of work, kind of laying the groundwork with young people to know who we are and know how they could access us. As well as this, we were kind of trying to get into education, social work, and the third sector as well, just to kind of get the name out there as well. But we're really starting to build that robust network now of kind of referral pathways and drop-ins, where Strive is becoming more known for being sort of one of the main substance use services for young people in the city. We know that it's a tricky subject working with young people in substance use, because of course there is that risk there, and it can be really difficult sometimes to only focus on the reasons why young people should say no to using substances. But as a service, we're really keen, and we'll make it a main point to kind of try and find out why they're actually saying yes as well. So as well as sort of things like fitting in, to have fun, to experiment, 83% of our young people actually said that we're using them to cope with things that are going on. And we found sort of gathering these live trends, kind of monitoring why they're using them, what they're using as well, has been really helpful for us to kind of monitor what issues they're facing at the time. And like that, I think someone mentioned earlier, trying to adapt it as soon as possible as well. We're not kind of collecting this just when it comes to reporting. We're really kind of trying to stay on top of it as well. And kind of collecting these is really useful for us to then feed into local schools or projects, kind of putting those alerts out there, maybe what to look out for as well. So in terms of kind of what a young person's journey might look like through Strive, as you'll imagine, it could be very, very different for every young person. But in terms of that initial referral, we've kind of mapped out how that might look. So what's really great about Strive is we don't really have a limited criteria for referral. So this can really come from healthcare, social work, education, parents and carers themselves. As well as this, young people can self-refer. So we're very techy that we've got a QR code that young people can self-refer. And it's a really simple form for them to fill out kind of why they think they might need support, contact number, that kind of thing. And this, again, just takes away those barriers from having to pick up the phone or go to the doctor and be referred, that journey as well. A really important part of all our referrals is that we do check, is there anyone else that you think might benefit from support apart from yourself? We know that loads of parents and carers really struggle to manage that young person's substance use. We've heard a lot about that today. So this is really about us trying to get in there as early as possible and kind of get that support there as well.
So once we have the referral, we take it to a weekly referral meeting. Earlier this year, the team identified a need for a weekly referral meeting in which we can discuss new referrals and provide support and guidance for the team's current caseload. This ensured that young people were getting seen in a timely manner and by a worker best supported to their needs. This is protected time in which the team can check in, seek advice and monitor well-being. This is extremely important to our team as well to prevent burnout, and by best supporting each other, we can best support our young people as well.
We know when it comes to that initial meeting for young people, it can be really daunting, and a lot of the time, they're maybe forced to come into the doctor's surgery or it's got to be in school, but it's really important for us that they decide where that is. So whether it is, just an initial phone call, if we're able to team up and do a house visit, they've got the choice of 2 locations as well, which is really, really helpful. And this just helps them choose kind of where they can see us. That initial appointment, we're trying to avoid sort of filling out loads of paperwork and that kind of thing. It's really for them to get to know us as workers, to get to know the service and think about what their support might look like. As I said, it could be different for everyone. Again, really important for us to encourage young people to decide if they're at a point that they want support. We've got a lot of young people, particularly kind of early teenage years, that they're there because their mum and dad have forced them to be there and they've got to speak to them because they've been caught, that kind of thing. So as much as, we try to have that motivational conversation around that they would benefit from this, we're very much kind of take that step and say, you have a think about this and we'll get back to you. And if you would like to see us again, most of the time they do, which is really good. But yeah, we do like to kind of give them that choice on the engagement and things as well.
So if a young person does decide that they would like to access support, we would then complete a holistic health check and an aims and goals document with them. This covers different areas of their well-being, including their physical, emotional, social and sexual health. And this just helps us identify if there are any other needs outside of their substance use that they might need any extra support with. Similarly, the aims and goals document is for the young person to set out their own goals and targets. For some, this might be to reduce their substance use, but for others, it might also be to improve other areas of their lives that they might need extra support with. This will then influence how the support is tailored, and then we review these aims and goals in later sessions. Hillcrest in the Corner used the same NHS EMIS system, where any member of the team has access to case notes and information as required. This was once a barrier where different services were using different systems. So now this allows for better communication, it solidifies our partnership working, and it also means that the young person does not need to retell their story.
So in terms of that ongoing support, we are really, again, we're kind of tailored to each young person. On average, we kind of aim to provide around 6 to 8 support sessions, but we know that it can take that time to build a relationship with a young person, and it's very situational. This might need to go on longer, and that's okay, but we always just say to the young person, let's start with this and kind of see how we got on at that point. We'll also offer young people whether they want to be seen weekly, fortnightly, if they kind of want a check-in every once in a while instead, to give them that time to work on maybe what we've chatted about before. And again, this just takes away those barriers from them feeling like they're having to meet our schedule instead of us kind of trying to work in with them as well.
So as I said, we review these aims and goals that are set by the young person. We also understand that a lot of young people benefit from someone to talk to about their substance use, and having that space to offload is extremely important. However, it is also important to keep these sessions focused on these goals set by the young person. Therefore, we have regular reviews to check in with the young person's progress, and it also gives us the chance that if we need to adapt their aims and goals.
So as a service, Strive is really about empowering young people to make those decisions and make those changes in their lives themselves, and setting these goals and supporting them to achieve them really helps to do this. Some young people might find themselves at a stage where they don't really need us anymore, and that's okay. However, some actually through the support have identified, I might benefit from counselling, or I want to speak to someone about employability. And the real benefit of kind of having that joint partnership is that our networks are much wider now. So actually, we do have a contact at employability that we can speak to, and it's just a phone call that takes that barrier away. And it's really to kind of try and help young people move sort of through one service rather than dotting about in loads of referral forums and meeting new people kind of all the time as well.
So once the young person is finished with support, we ensure that they are aware that they can return at any time, whether this is just a check-in or if they need to re-refer. It is important to note as well that, as previously mentioned, some young people might not be ready to engage. Therefore, we encourage them to return whenever they are ready.
So to give you a bit of a real-life example of this, we've got a case study. We've changed his name to Owen for the sake of today. Owen is 19, and he first came into the service through our Southward Road Community Recovery Cafe. So this is a lot of adults attend at Southward Road. Owen had kind of said that, I'm ready for support. I'm really struggling just now, so a referral went into us at Strive. Claire started working with Owen to kind of explore his cannabis use and the impacts that was having on his life. And through this, we can identify that Owen also needed some support with his benefits. He also wasn't registered with a GP, and he had no means of transport as well. So working with Claire, he was able to get registered with a GP, apply for his bus pass, and Claire was also able to get him a bike through one of the community centres as well. So great for helping him kind of improve his mental health, which was something that he identified was the reason he was smoking cannabis, and kind of work through that there as well. So Owen kind of got to a point where he felt he didn't need the service anymore, so that was okay. We kind of said, like what we've mentioned, come back at any time. And about a month later, he did. He reached out to Claire and he said, I'm having a little bit of a dip. Could I get your support again? And Claire said, no bother. We picked up the support right from where he left off. It wasn't a case of having to wait again. It was, I think you caught up the week after or something, wasn't it? And you were able to get that again. Owen has recently now got a starter pack for his flat and things as well, so we're kind of, it's always moving on in terms of his needs at the time, and he's still engaging right now with Strive as well, which is fantastic. And we think this is a really great example just to show the many touch points that young people can have, but actually it's the ability to be seen within these services rather than out with, and we've tried to reduce young people kind of bouncing about different places and getting told different things as well, avoiding those sort of significant referrals.
So this is some feedback that we've received from our one-to-one sessions. For us as a team, it's extremely important to hear back from our young people and receive feedback, whether this be after the referral or after the session, as this just helps us develop even further as a service.
So yeah, I'll just give you a little minute to read some of them on there. And as I mentioned earlier, we also trialled our Know Your Stuff workshop this year. So we trialled this out for Overdose Awareness Day, and the event was a great success. We've since delivered this at local colleges to some of the staff there, and we've had requests to deliver this out at public health teams and with school staff as well. And we also have these little information cards. You might see them dotting about Dundee anyway. And on these we have a QR code, again, very high tech, that we scan in, and it takes you to our sort of Strive one-stop shop. In this, it's got information about, if you're struggling with your own substance use, if you're worried about someone else, but also kind of links to things like Talk to Frank, Scottish Families, just kind of where you can get that support as well. We're also wary that, as a service, we're limited in the times that we can offer support at the moment, so we do make sure that we've got links to sort of local food banks, kind of out-of-hours provision, that kind of thing as well. And in terms of kind of what the workshop itself included, we were really keen to kind of explore some of the signs. Now we know drug trends are always changing, and I think a lot of adults identified that maybe what they'd witnessed when they were kind of growing up is way different from what we're seeing now. So actually helping them to kind of have a look at some of those signs and what to look out for, but also acknowledging kind of the different reactions that they might have to finding out a young person is using substances. And actually these are all very normal, but actually how can we make them a little bit more proactive and supportive as well. In terms of our wider education sessions, when we were speaking to some of our older young people, so sort of 18, 19, and would kind of say to them, what drug education did you get kind of growing up? And it was very much sort of just one SE lesson, or maybe a police officer came in and told us that we'd all go to jail if we use drugs, that kind of thing. So we sort of identified the need to actually get in there a bit earlier and kind of provide that sort of evidence-based, realistic support as well, which so far we've kind of trialled a 6-week block at 2 education sites in Dundee, and they've been really, really well received. These kind of cover a wide range of topics and really encourage those discussions with young people to look at not just drug use itself, but a lot of the wider impacts that it can have on young people's lives. As well as this, we're always there to kind of plant that seed about where they can get support as well.
So again, we appreciate any feedback that we can get, and as you can see on the board, 100% of our young people are recommending our education sessions. This again helps us better tailor these sessions to young people's needs, and it also helps us keep up with the local drug trends. As well as checking in if they enjoyed the session, of course, it is important to us that there is an education element. Therefore, through our feedback, we can see what they have learned and what their main takeaways were. So again, this is some more feedback from what they have learned from our sessions. So we understand the need for an early intervention. Therefore, many of our young people attending our education sessions may not currently be using. However, this does let us plant the seed of where they can access support and make sure that they're aware of who they can talk to if they are struggling.
So it has been a fantastic 2 years so far. We're all really, really grateful to do the job that we do and work with such fantastic young people, but also within such a supportive and passionate team. And some of them are here today, which is great. Of course, our next steps are to continue the work that we're doing and deliver this sort of to complement the rest of the work that's going on within the Dundee ADP, but actually as well keep monitoring how we might need to adapt that to fit the needs of Dundee's young people. So some changes and developments that are coming up is that we're really trying to get out into the community as well, where we can offer young people more ad hoc support. So something that we're kind of picking up in terms of struggling with engagement is kind of keeping those appointments and things too. So actually if they know, I can see Erin or Katie between 1 and 4 at a local community centre, that sits a bit better with me than rather having to keep that appointment every week as well. So developments are kind of underway to look at how we can hold them in community centres, schools and GP practices as well. We're also developing a Strive workbook, and this just helps us focus the sessions a little bit more with the young person and allows them to reflect on the discussions that we've had, but also have that little bit of evidence of how much they've achieved as well. We're always keen for new partnerships as a service, and just to help strengthen the variety of support that we can offer young people. We've recently linked in with Citizens Advice, and we are organising for a monthly drop-in to be held in the corner so that young people can access that directly, but also that to almost be part of their involvement with Strive is that they do get a benefit check and kind of make sure we're meeting all their welfare needs as well. So that really has been sort of a quick tour of Strive. I'm very aware that we're at that slump in the day where everyone's probably needing another cuppa and things, but we really do think this is such a positive service for Dundee. As someone that's grew up in Dundee, it's really great to be a part of this, and we hope to continue to see the difference that this is making to the lives of not only young people but families that are affected as well. Thank you so much for listening. That's our contact details up here.